Every year, thousands of loving dog owners miss the earliest warning signs of cancer simply because those signs look harmless at first. A tiny lump that doesn't hurt. A day when your dog seems a little more tired than usual. A sudden change in appetite you blame on the weather. But what if I told you that these small, easy-to-ignore symptoms are often the first clues that something much more serious is happening inside your dog's body? Almost half of all dogs over the age of 10 will face cancer at some point in their lives. Yet most cases are discovered only when the disease has already grown strong. Today, we're breaking that cycle. Before we go any further, ask yourself, if your dog was showing the earliest sign right now, would you even know it? This video might be the reason you catch something early enough to save your dog's life. So stay with me. What you're about to learn is truly eye-opening for every dog owner. Hi everyone, and welcome back to the channel. If you're a dog owner, a pet lover, or simply someone who cares deeply about the animals in your life, then today's video is one you absolutely cannot afford to skip. When it comes to cancer in dogs, timing is everything. Early detection can mean the difference between a simple treatment and a heartbreaking outcome. The purpose of this video is not to scare you, but to empower you to give you the knowledge that most owners never receive until it is too late. Today, I'll be sharing the most commonly overlooked early signs of cancer in dogs, based on patterns veterinarians see every day. These signs are subtle, easy to miss, and often mistaken for normal aging or routine illness. By the end of this video, you'll understand exactly what to watch for, why each sign matters, and when it's time to schedule a checkup. If you've ever wondered whether you'd be able to recognize the first clue that something is wrong, this video will give you the clarity and confidence you need. So, let's begin, and let's make sure that every dog gets the chance at early diagnosis and a longer, healthier life. One of the earliest and most commonly missed signs of cancer in dogs is the appearance of small, painless lumps on the skin. Many owners ignore these bumps because they don't cause discomfort and often stay the same size for weeks or even months. But here is the truth: most people don't know. Not all dangerous tumors grow fast, and not all harmless ones stay small. Some of the most serious cancers begin as tiny, soft nodules that feel almost insignificant when touched. Because dogs can't tell us what they feel inside, it's our responsibility to pay attention to what their body is trying to show us. A monthly lump check is one of the simplest habits you can develop. Slowly run your hands over your dog's neck, chest, belly, legs, and tail. If you notice a lump that wasn't there before, or one that changes shape, gets firmer, or becomes irregular around the edges, it's time to have a veterinarian examine it. Early testing can reveal whether it's harmless, fat, or something more serious. Many cancers, when detected at this early stage, can be treated before they spread. Never assume small lumps means small problems. They might be your dog's first and only warning. Unexplained weight loss is another major sign that something is happening inside a dog's body, yet it's one of the easiest to miss. When a dog continues to eat normally but still begins to lose weight, the reason is almost never simple. Cancer alters the body's metabolic process, forcing it to burn energy faster, even when the dog is resting. Some cancers interfere with digestion, preventing the body from absorbing nutrients from food. That means your dog can finish every meal and still lose weight at a noticeable pace. Owners often blame this on aging, weather changes, or even a temporary drop in mood. But weight loss without a clear cause should always be treated as a warning. If you see your dog's ribs becoming more pronounced, their waist narrowing, or their muscles looking thinner, it's time to pay attention. Even a small drop in weight when nothing else has changed deserves concern. Cancer-related weight loss often begins slowly, almost unnoticeably. But by the time it becomes obvious, the disease may already be progressing. Regularly checking your dog's weight, even once every few weeks, is one of the easiest ways to detect hidden problems early and give your dog the best chance at timely treatment. When a dog becomes less energetic, many owners assume it's just aging or a mild illness. But a noticeable and unexplained drop in energy can be one of the earliest signs of internal cancer. Dogs express fatigue in subtle ways at first. They may sleep longer than usual, hesitate to go on walks, show less excitement when you return home, or stop playing with their favorite toys. Because these changes happen slowly, owners often normalize them. But if your dog suddenly seems tired all the time without any clear reason such as heat, long exercise, or recent illness, it's worth paying attention. Cancer drains the body's strength, often causing exhaustion long before any visible physical symptoms appear. Some cancers affect the organs responsible for oxygen and blood production, making your dog feel weak, even during simple activities. Others release substances into the bloodstream that make the dog feel unwell. If your once active dog starts acting withdrawn, uninterested, or unusually quiet, do not ignore it. Dogs instinctively hide pain and sickness, so noticeable fatigue means they're already struggling. Trust your observations. You know your dog's personality better than anyone. Early attention to changes in energy levels can lead to early diagnosis and better outcomes. A sudden change in appetite is always meaningful in dogs, especially when it lingers for more than a few days. Cancer can affect a dog's desire to eat in many ways. Tumors in the stomach, intestines, liver, or spleen can create discomfort or nausea, causing the dog to lose interest in food. Oral cancers, which often go unnoticed until they become severe, can make chewing painful, leading the dog to drop food from their mouth or chew on one side only. Many owners mistake this for pickiness or mood changes, but dogs are rarely picky eaters by nature. If your dog stops finishing meals, hesitates before eating, eats very slowly, or walks away from food altogether, treat it seriously. Even subtle signs like refusing crunchy treats, preferring soft foods, or drooling excessively during meals can point to something deeper happening inside the mouth or throat. A dog's appetite is one of the strongest indicators of its internal health. When it changes significantly, the body is trying to say something. Cancer-related appetite loss often starts mildly and becomes more noticeable over time. Addressing it early gives you a better chance of catching the underlying problem before it becomes life-threatening. A persistent cough in dogs is often dismissed as allergies, dust irritation, or a harmless cold. But if the cough continues for more than a couple of weeks, it can be a sign of cancer affecting the lungs or chest area. Lung tumors may not cause pain early on, but they interfere with the dog's ability to breathe comfortably. The dog may cough when lying down, after activity, or even during rest. The cough may sound dry, soft, or sometimes deep and harsh. Breathing changes are also common. You might notice your dog taking quicker breaths than usual, panting without exercise, or struggling slightly when inhaling. Some cancers cause fluid buildup around the lungs, making each breath feel heavy. Because these symptoms can resemble common respiratory infections, owners often wait to see if they improve, but cancer-related coughing rarely gets better on its own. If your dog's cough doesn't improve after basic treatment or continues to return, it's important to investigate further. Early X-rays or scans can detect tumors or abnormalities before they spread. Respiratory signs should never be ignored, especially in older dogs. Early action can make a major difference in quality of life and treatment options. Limping or stiffness that doesn't improve. Limping in dogs is often blamed on minor injuries, joint stiffness, or arthritis. But one of the most aggressive dog cancers, osteosarcoma, begins with mild limping that seems harmless at first. This cancer affects the bones, causing pain that gradually increases over time. In the early stages, the discomfort may come and go, making owners believe their dog simply strained a muscle or played too hard. But unlike injury-related limps, cancer-related lameness does not fully disappear and slowly worsens. Dogs may avoid putting weight on one leg, hesitate when climbing stairs, or struggle to get up after resting. Some dogs hide the pain by moving slowly or avoiding activities they once loved. Owners often assume these behaviors are normal aging, but persistent stiffness and limping require attention. Bone cancer grows quickly, and early detection offers the best chance for treatment. If your dog's limp lasts longer than a week, gets worse at night, or is accompanied by swelling around the limb, it is important to schedule a vet visit immediately. Pain in dogs is subtle, and they rarely cry out, so visible limping means the discomfort is already significant. Acting early can save your dog weeks or even years of suffering. Occasional stomach issues are normal for dogs, but frequent vomiting or diarrhea over an extended period is not. These symptoms can indicate gastrointestinal cancers or tumors affecting the digestive system. In many cases, the vomiting may appear mild at first, perhaps once a week or once every few days, but gradually becomes more common. Diarrhea may come and go, leading owners to assume the dog ate something unusual. However, when these symptoms persist for more than a week, or return repeatedly over time, the underlying AOCs may be more serious than a simple upset stomach. Cancer affecting the stomach or intestines can cause chronic irritation, internal inflammation, and difficulty processing food. Some dogs also experience bloating, discomfort after meals, or sudden interest in eating grass. While these signs can be associated with other conditions, they should never be ignored. Persistent digestive problems weaken your dog's immune system, cause dehydration, and prevent nutrient absorption. If your dog is vomiting repeatedly, has ongoing diarrhea, or shows both symptoms alternately, it's important to consult a veterinarian and consider further testing. Early diagnosis gives your dog a greater chance at recovery and a better quality of life. Dogs express discomfort and illness through behavior long before physical symptoms appear. Early cancer can cause subtle changes in personality that owners often mistake for aging, stress, or temporary mood shifts. A normally playful dog may become quiet or uninterested in toys. A friendly dog may start avoiding people, hiding in corners, or refusing to engage in family activities. Some dogs become unusually irritable or sensitive to touch, especially if there is internal pain. Others show signs of anxiety, pacing at night, or acting restless without reason. These behavioral shifts happen because cancer places strain on the body, affecting energy levels, hormones, and overall comfort. Dogs are instinctively good at hiding weakness. So when behavior changes become noticeable, the dog may have already been struggling internally for some time. If your dog seems not like themselves for more than a few days, it's worth looking deeper. Sudden personality changes are one of the earliest clues that something serious may be happening beneath the surface. Observing your dog's behavior is just as important as watching for physical signs. When something feels off, trust your intuition. It's often the first step toward catching a problem early. Bad breath is common in dogs, but a sudden, foul, or unusual smell can be an early sign of cancer, especially oral or throat cancers. Many owners assume bad breath is simply poor dental hygiene, and sometimes that's true. But cancer-related bad breath has a distinct, more intense odor, often metallic, rotten, or unusually strong. This happens when tumors develop in the mouth, gums, or throat area, causing cells to decay internally. You might notice additional signs like excessive drooling, difficulty chewing, dropping food, or swelling around the jaw. Some dogs may lick their lips frequently or paw at their mouth. These symptoms are often subtle at first, making early detection difficult. Checking inside your dog's mouth regularly can help you catch abnormalities before they worsen. Oral cancers spread quickly, and by the time the smell becomes consistent, the disease may already be advanced. That's why monitoring changes in breath is crucial. If your dog suddenly develops persistent bad breath that doesn't improve after dental cleaning or proper hygiene, it's important to schedule a vet examination. Early diagnosis can significantly improve treatment outcomes and prevent the cancer from spreading deeper into the tissue. A wound that doesn't heal is one of the most overlooked signs of cancer in dogs. Normally, small cuts, scratches, or minor infections heal quickly with basic care. But when the immune system is weakened by cancer, or when cancer is affecting the skin itself, wounds may remain open for weeks without improvement. Owners often try home remedies, or assume the dog keeps licking the area. But if a wound refuses to close, bleeds repeatedly, or becomes larger over time, it may be signaling something more serious. Some skin cancers begin as what looks like a harmless sore or irritated patch of skin. These growths are often flat at first and can easily be mistaken for allergies or reactions to insect bites. As the cancer spreads, the wound may ooze, develop scabs that fall off repeatedly, or change color. When a wound does not heal in a normal time frame, it is the body's way of showing that something is interfering with the healing process. Dogs don't hide these wounds intentionally. They simply cannot overcome the underlying issue. If you notice any persistent or worsening skin problem, it's important to get it checked professionally. Early identification can prevent serious progression and reduce the need for aggressive treatments later. Any form of unexplained bleeding in dogs should be taken seriously, especially when it occurs without visible injury. Nosebleeds, for example, can be an early sign of nasal tumors. These cancers often start deep inside the nasal passages, causing sporadic bleeding that may appear and disappear unpredictably. Ear discharge, especially when falz-maling or mixed with blood, may indicate tumors affecting the ear canal. Similarly, blood in the stool or urine can signal cancers of the bladder, kidneys, or intestinal tract. Some dogs may experience bleeding gums without dental disease, which can indicate blood-related cancers that affect clotting. Vaginal discharge in female dogs, especially when containing blood outside of heat cycles, can also be a warning. Owners often assume bleeding is due to minor irritation, seasonal changes, or accidental scratches. But when it happens repeatedly or without clear cause, internal cancer becomes a possibility. Even small amounts of blood can represent big problems. Monitoring your dog for new or unusual discharge is essential. If you see persistent or unexplained bleeding from any part of the body, consult a veterinarian immediately. Early testing can provide answers and potentially catch cancer at an earlier and more treatable stage. Changes in urination or defecation patterns are often early indicators of internal cancer. Dogs with bladder or kidney tumors may start urinating more frequently, straining during urination, or producing smaller amounts of urine each time. Some may cry out softly or lick themselves repeatedly due to discomfort. Blood in the urine can appear as a light pink tint or dark red streaks, and even slight discoloration should not be ignored. Similarly, intestinal cancers can cause changes in stool shape, consistency, or frequency. Dogs may become constipated for several days or have recurring episodes of diarrhea without explanation. Sometimes, the stool may appear thin like a ribbon, which can indicate a tumor pressing on the intestines. These changes are often misinterpreted as dietary issues or sensitivity to certain foods, causing owners to delay proper medical investigation. But when bathroom habits shift drastically and repeatedly, the underlying cause may be more serious. The digestive and urinary systems are closely connected to overall health, and cancer in these areas often shows itself through noticeable bathroom changes before more obvious symptoms occur. Paying close attention to these patterns and seeking veterinary evaluation early can make a significant difference in your dog's treatment options and long-term well-being. As we wrap up today's video, remember this: dogs cannot speak for themselves, but their bodies are constantly sending signals. Every lump, every change in energy, every unusual behavior is their way of communicating that something may be wrong. As loving owners, it's our responsibility to listen carefully and act early. Catching cancer or any serious illness at the earliest stage can make an enormous difference in treatment options, recovery, and quality of life. If you noticed even one of the signs we discussed today, don't wait. Schedule a vet appointment, keep track of any unusual changes, and be proactive about your dog's health. Regular checkups, careful observation, and quick action are the most powerful tools you have to protect the life of your furry friend. And finally, share this video with anyone who has a dog and subscribe this channel. Awareness is key, and the more people who know these subtle early warning signs, the more dogs we can help. Our pets give us unconditional love every single day. It's up to us to give them the care and attention they deserve. Thank you for watching, and here's to keeping your beloved dogs happy, healthy, and safe for many years to come.